Hi, I'm Dr. David Hill, and today we're going to talk about how to treat sinus congestion and cough in children. Now, children get colds all the time. Probably the very worst time is in the toddler and preschool years, but certainly it goes on up into elementary school. And they have some symptoms that are really distressing. Cough is the worst. Now, when we talk about cough, I like to clarify there are some coughs that you don't want to treat at home. If you hear a high-pitched sound when your child is breathing out, that's wheezing. That requires emergent therapy, and your child should be seen immediately for that. Likewise, if when your child breathes in, there's a horrible kind of barky, sealy kind of sound, that's croup. And if that doesn't get better with a few minutes of humidity in a warm shower or with some cool air outside, if your child looks like he or she is frightened that he's not getting enough air, well, for gosh sake, take that child to get care immediately. You don't want to treat that at home. So what can you do about cough at home? Well, I got some bad news and I got some good news. The bad news is the medications that are sold over the counter for cough really, as far as we know, do nothing for children. There are no decently controlled studies, decently run studies that show these medicines do anything. In fact, the most commonly used cough suppressant, dextromethorphan, is now no longer recommended for children at least up to age 6, and frankly, there's really no reason to give it to children at all because it doesn't do what you want it to do, and it may cause side effects. So what are you going to do instead? Guess what? Honey. For any child who's greater than 12 months of age, a teaspoonful of honey works as well as anything for cough suppression. In fact, in one study, it was tried against dextromethorphan, and honey did better than the medicine. So why take a risk on the medicine when you can use honey? Now, I said over age 12 months. You mustn't give honey to an infant, a child who's not yet 1 year of age. Why? Because it carries a risk of botulism. Botulism can be a deadly nerve disease, and that baby might stop breathing. That's bad. So what are you going to use instead? You could try a little corn syrup. Cairo is a very popular brand, but any corn syrup will do. It's prepared sterilely, and there's not a risk of botulism there. Other things that may help, you might elevate the head of the bed. You can put a humidifier in the room, which could be a little bit helpful. Now for nose congestion, what are you going to do? The standby here is nasal saline drops. It sounds boring, but it works really well. You can even make them at home. You don't have to go buy them. You just take a half a teaspoon of salt and 1 cup of water, boil it, let it come to room temperature, dribble a little bit in the nose. That'll help clear things out for a while. Now, for a badly runny nose, children age 6 and over can use a medication called ipratropium. It's not very popular. You don't hear a lot about it, but it works really well. It's generic, and your child's doctor may be familiar with it and willing to prescribe it. Unlike some other nose sprays, it doesn't cause a rebound when you stop using it. Now, if the nose is super stuffy, you can use a decongestant spray such as Afrin, oxymetazoline, phenylephrine are a couple of choices there. However, you can't use it more than 2 or 3 days or it's going to be horrible when you stop. This does cause rebound stuffiness. These are medications you really want to use with great discipline, or even better, just don't bother. Now, if your child's cold symptoms are going on greater than 10 days without getting any better, you probably want to seek a doctor's advice at that point. Likewise, if they have a fever that's going on greater than 3 days, ear pain, pus sticking the eyes shut, or breathing trouble, seek care. Talking about what to do for your child's cough and congestion, I am Dr. David Hill.